Welcome to Security Tales. Thank you so much, and everyone on Facebook, hopefully, and YouTube. Hopefully, you're not hearing a reverb that's occurring while we
Reverb.
speak. A reverb, whatever you want to call it. Hello, hello, hello. So first, I got to move my purse from here so I could sit.
It's my
And
purse.
oh, yes, yes, yes. So first of all, thank you so much, and hopefully people can jump on without my warning and telling you. Okay, we're also waiting on my guys to check on something for me to make sure we're not echoing in here. But first of all, thank you so much, and I'd like you guys all to welcome back Dr. Wynne Huang. We're wicked glad to have you with us again, especially during Skin Cancer Awareness Month. So, Dr. Wong and me today, we're just having a discussion, and she would like to do a podcast to discuss about some skincare, and because it is Skin Cancer Awareness Month. So, we appreciate your expertise and insights on your priceless in helping our listeners understand the importance of skin health and early detections. Thanks a lot for joining us today, Dr. Wong.
We're echoing. We heard from one of our viewers that we're echoing.
We're echoing still?
Echo, echo, echo.
Seriously?
Yes.
Oh my God. Why am I echoing? Am I still echoing?
Are we still echoing? Echo, echo.
No, they're saying it sounds good. All right, all right. I don't know why I'm hearing we are echoing. And
It's
then we're
better
not.
now.
Okay, okay. Well, thank
Okay,
you.
okay.
All right, all
All
right. Let's
right, all
get
right.
it going. Obviously, Dr. Wong's got
The
jokes
mic
already
is a
started.
bit off.
Okay, so
Is this better?
the mic's a little bit
I'm
off.
getting some feedback from my millions of viewers. Okay, I think we're good. I'm
All
gonna
right.
go for it.
So listen, first we're going to start right off. Right off. Can you start by telling us a little about your background and what drew you to specialize in skin and healthcare with cancer?
Sure. So I'm a primary care physician, but I have an interest in skin. Did you know that the skin is the largest organ in our body? So, as a primary care physician, we take care of the entire family and the entire body. So, skin is really important because sometimes if you recognize something in the skin, it can indicate something that's wrong on the inside of you.
Okay. So was that your answer to tell us why you got into the background of it?
Why I got into dermatology, my
No,
interest in
you're a
dermatology.
primary care physician, but I want you to tell us a little background and what drew you to specialize in skin health. Like we're discussing about skin health right now, so I wanted to know
Oh, I see.
what.
I see.
Yeah.
I
Okay. Was that one of your jokes that you were supposed to start off with? I didn't know.
No, I've had a long week. It's been a long week, and
Oh,
the
okay.
weather's not helping.
Okay.
It's 40
If you
degrees.
want me to slow it down, Dr.
No, I
Wong, I will
gotcha.
graciously do that for
So
you.
anyway, well, I own a med spa. So as part of
The
the
med
med
spa.
spa,
What's your med spa's name?
Radiant Medi Spa.
Excellent.
And so in the med spa, I focus on skincare. We actually have two estheticians, Cindy McGurran and Melissa Nenny. So they take care of any
Shout out.
woo take care of any skin conditions that need treatments with like chemical peels, hydrofacials, laser treatments. I do anything that involves needles like Botox and fillers. So I enjoy helping people look their best.
Thank you, Marcus. I did exactly what you said and shut down the arrogant and went with the sure.
Thank you, Marcus.
Okay, so that's great. So why skincare awareness particularly important during this month? Like why what's going on? Like is every month some type of let's pick something to donate time to? So what made this month skin awareness?
I
Is
don't,
it because it's closer to the summer? Is it because it's sunnier? Does it matter if it's a winter, summer, fall where your skin could catch skin cancer? Does it matter?
I don't know why May is Skin Cancer Awareness Month. I can't answer that. Someone arbitrarily decided. But to answer your question, you should be aware of skin care and sun protection all year round. Did you know that you can get skin cancer in parts of your body that never see the sun?
Yes.
And you know what parts I'm talking about, like the
Yes.
bottom of your feet. Don't I wasn't thinking those other parts. But
I was not either. I just remember you telling me you know someone that got skin cancer on the feet. So I was actually thinking of the bottom of the feet.
yes,
Okay.
but other areas too that never see the sun can get skin cancer.
All right. So what types of skin cancers are there
Well,
and what should they be aware of?
the most dangerous one that we worry about is melanoma. And the reason we worry about melanoma is it's not just on your skin, but it can actually spread through your bloodstream and your lymph nodes to all different parts of your body, and you can actually die from it.
Really?
Yeah,
So that's funny.
it's
Well, it's
not
not
funny.
funny. What I meant to say is
That's interesting.
it's more than interesting. It's because I've had some people that I've been associated with that have melanoma, but internally.
Hmm.
So you just don't get it on your skin, right? You
That's
get
right.
it, you can get
You
it
can get in
internally.
your eye, which is very, very rare, but we both know someone who got it in their eyeball, and
Yes. So
unfortunately,
when we discuss it and you bring up that the term it's skin cancer, when you bring melanoma, there's different parts or different areas, like per se. You can't just say melanoma is skin cancer, or is it still called skin cancer if it's internal?
melanoma is still skin cancer. So melanoma, so there's melanocytes in our skin. Melanocytes are the cells in our skin that produce the skin color.
Yeah,
And
determination of color.
so melanoma is when these cells start to change and they become cancer. And then what happens is this cancer is very aggressive. So then it can go into the bloodstream and the lymph nodes and spread throughout.
Hmm. So, what are the main risk factors that increase a person's likelihood to get skin cancer?
I would say that the most common or highest likelihood is sun exposure. Although, like I just said before, you can still get it, even in areas of the body that don't see the sun. But it would definitely be sun
So it doesn't.
exposure or tanning.
That's
Um,
what I was about to
yeah,
ask. So if you were to use unnatural light, tanning boots and things like that, could that cause skin cancer?
100%.
Really? So
Yes,
any type of light that's fierce onto the skin could cause detrimental harm to your skin.
yes.
So so it doesn't matter if you're dark or light or like I always hear when I come back, people are like, "Oh, you peel?" And I'm like, "Yeah, I peel." I never understood what people mean by that. Yeah, I can get skin cancer. Yeah, I can get this and that. So it really doesn't matter about color of skin. Doesn't matter about
You could be as black as this
genetic.
phone and you could still get skin cancer.
Okay, well, thank you for pointing that out, Doctor Wong. Yes, you can be as black as this phone and get skin cancer. Didn't realize that. All right.
I mean, there so but let's just backtrack a certain. So what you were talking about before, like when people say, "Oh, do you peel?" and stuff, that's what we're talking about Fitzpatrick types. So Fitzpatrick typing 1 through 6 is a way to
So what's Patrick mean?
Fitzpatrick, yeah. So it's a category, skin categorization from 1 through 6, where we categorize your skin's, I guess, ability to burn or tan.
So I got an interesting question. So you said Fitzpatrick?
Mhm.
So is it named after an Irish person? Is this where they came up with the name Fitzpatrick to determine the skin color?
I honestly don't know where it came from,
I
but
find that
I
interesting.
can tell you. So, for example, type 1 would be so like a fair Irish person with blonde hair, blue eyes, or like a redhead. And
Okay.
then 6 would be a very, very dark African American. I would say, for example, that you and I are probably a type 4. So when we do skincare treatments in the Medi Spa, these are very, very important questions to ask, and it's not just about looking at you, but it's also about your genetics. So, for example, like your background. So, even though someone may look pale, if they have a darker background, like their dad is African American, but their mother's Caucasian, but they have light skin color. These are important things to know because your melanocytes are going to react differently. Am I boring you, sir?
I'm listening, but at the same time, because I think the viewers and everybody else would love to know where did the name Fitzpatrick come from and why. And now I know. So
Well,
now I was
please
gonna read.
share.
No, I was gonna let you finish yours and then go on.
So, for example, so when we do like chemical peels or laser treatments, it's very important that we know what skin type you are, so that we know how to treat you appropriately without so you have an effective treatment without causing damage to the skin.
So I find this interesting. So you had said if your mother or your father was a different race and the mother was another race, you can take on the traits of one individual and you can make that determination on picking the skin type.
So let's give an example. So my friend Leslie, she's Portuguese. And I forgot unfortunately one time to take that into consideration when I was treating her with the laser. So she has pretty pale skin. But with her Portuguese background, I should have considered that she might have like a higher Fitzpatrick skin type. For example, like closer to like a 4 or something instead of like a 2
Yes.
because of her
So
of
you
her
treated
background.
her like she was a Caucasian,
Yes.
but in reality, you should have treated her like a level 4.
Yes.
Okay. Like us.
Yes.
Okay. So I would like to interrupt really fast and just explain what the Fitzpatrick skin type
And
classification was
in
developed.
my defense, I wasn't giving anything to prepare for this podcast, so I'm going off the cuff here.
That was your idea. I was just
I
giving
didn't
you
know the
questions.
questions you would ask me.
Oh, okay. So once again, my fault. My fault. So it was developed by Dr. Thomas Fitzpatrick in 1975, and it's named after him. It's a system that categorizes skin based on how to react to sun exposure and how much melanin is contained. The system is used to estimate an individual's risk of developing skin cancer, with lighter skin types generally considered at higher risk. So that's it. He was a dermatologist. All
Pretty much
right.
what I said.
Yes. So, how does UV exposure contribute to skin cancer risk, and what precautions can people take when they are spending time outdoors?
So UV exposure starts to cause the melanin, like I said, the skin cells to start to change. So we we try and protect ourselves. So when we try and protect ourselves from getting burned, the skin starts like, oh my gosh, this is really hot. I need to start getting like tougher or thicker, whatever tan, so that nothing happens to the skin. So when anytime a cell starts to change, you increase your risk of cancer developing. So, and what precautions can be done is to wear sunscreen and not just wearing sunscreen. Um, Actually, I had a joke. What's the best type of sunscreen to wear?
Why?
The one that you'll wear. Because people always ask me, what's the best sunscreen? And you could have the best sunscreen in the world, but if you don't apply it, it's not going to help.
Okay. So, that's interesting you said that, because I know one of the top sunscreen companies now is under lawsuit for falsifying that they've been the best sunscreen protector. And they're now being held liable because the chemical that they have in it actually causes skin cancer.
Is that
So
Neutrogena?
no, it was the that bottle that you spray the yellow, blue, orange liquor on.
Oh,
There's a huge lawsuit. I forgot. I should have just looked it up.
oh,
Um, but that's interesting that you say, because when I go see your esthetician,
s-
um,
both plural.
yes, they tell me to use the, I think it's 70 when we're in Mexico, but then lighter when I'm here.
So let's talk about that. So that's an interesting topic. So SPF, do you know what SPF stands for?
Something sun protection Fahrenheit.
Sun protection factor. Close, but no
Whoa,
cigar.
whoa! I was close. I was
Sun
close.
protection factor. So what that means is that is how much that number sunscreen protects you against the sun if you weren't wearing it. So for example, if you burn after 15 minutes of being in the sun, if you applied an SPF of 30, that means it would protect you 30 times longer. So that means if you multiply 15 times 30, theoretically, it would protect you for 450 minutes. But I say theoretically because that depends on if you apply your sunscreen correctly, which means A, you put it on 20 minutes before you go outside. Theoretically, you're supposed to reapply 2 hours after. And also all the conditions like rain or going in the water or wind or like wiping your face, that's going to take the sunscreen off. So in a perfect world, the SPF of 30 means it protects your skin 30 times more than if you weren't wearing the SPF.
Okay. So is there a difference from a spray on SPF and a cream SPF?
I think that, well, I mean, for convenience sake, I think the spray is obviously easier for people to get over their whole body, but the skin on your face is much, much more delicate and I think needs extra protection. I think for the face, it's critical to use a topical um, sunscreen that's gonna be applied, and I personally like anything that has zinc oxide. So zinc oxide is not only a chemical protection, but it's like a physical barrier. It's like that sunscreen you see kids wear where it's like all different colors and stuff like a paste,
Mhm.
but obviously you can't go around wearing sunscreen that's like pink or blue, but they do make sunscreen like we sell in our office PCA. Their sunscreens have zinc oxide. So it's again, not only like a chemical barrier, but actually like a physical barrier where it's protecting that layer of the skin.
Okay. All right. So there's certain skin types or demographics um, that are more at risk.
Well, as I said before, like if you're type 1, your skin is going to be more prone to burning.
So when you're saying type one,
A
can you
Fitzpatrick type
elaborate?
1.
But can you elaborate what type one means? Does that mean a person that's darker skin, person lighter skin?
I
So
said that earlier.
I
I
know, but
said,
can you
oh,
elaborate,
oh, so
please?
that
So
would
I'm
be,
asking demographics. I'm
oh,
talking
so
about
like what, like
locations.
Irish, like
Yes,
pale,
that's what I'm asking.
blonde hair,
Yes.
blue eyed with red hair. Typically, those are type
Okay.
1,
Okay.
much, much more at risk. And
So
obviously,
so the lighter your skin is,
yes,
the more at risk you could be.
yes, because the more easily you're going to burn.
So I know a friend of mine that had a white pit bull, and he used to have to put sunscreen on him, and he ended up with skin cancer. So that's kind of sad, but I never would even know.
I had a white horse and I had to put sunscreen on him on his
Really?
nose. Yeah,
So can you talk about the importance of regular skin checks and like self examinations and
sure.
how you would do it?
So if you're gonna do a full skin check, you really have to start from the top, check in your hair. So like spread your hair apart and look like throughout your hair. Um,
So how would I do that?
have someone spread. Well, you'd have to take your hat off first.
No, I know, but how am I to look for it? So I
Well,
would have to have
well,
somebody look for me.
Well, yeah,
Okay.
usually if we're really concerned. So, what I tell my patients is, hopefully, did your partner or someone else see anything concerning in your body? And when they come into my office just for their routine physical, I make it a habit of always checking people's backs because it's hard for you to see your own back. And I've actually picked up a couple of melanomas on people's backs and buttocks. But if you have a lot of moles, I recommend that you go see a skin doctor, a dermatologist, because they can actually map all of your moles, like number all of them and track them. They have computer systems for this.
So what are they tracking for if
And
they were already there?
so when you go in every 6 months or every year, they know and they have pictures of them and they can see if they've changed. So when you go see a skin doctor,
Changed how though?
well, we can talk about that.
Okay.
But so when you go in for the skin exam, to the proper way to do a full skin check is to look in between everything. So again, starting from the top, going through the scalp, separating the hair, you going down, looking in between your fingers, in between your toes. Um, it's a full at the bottom of your feet. It's a full
So what am
exam.
I actually looking for is my question. So
S-
I have brown spots that are in my arm.
Oh,
I
sure.
have brown spots on my leg. What am I actually looking at?
Well, Felipe, let's talk about the ABCDEs of melanoma.
Absolutely.
How's that? So, I'm going to tell you the ABCDEs of melanoma are things that we look for when we're looking at a mole because you're absolutely right. You could start looking at all your moles and they can be very confusing. So, I don't know if people can see this. So, I'll go up closer. Will they still be able to hear me?
Hmm.
Okay. So, we have here A is for asymmetry.
But YouTube can't see,
Oh,
YouTube's behind your head. You're covering the camera now.
oh. Well, I don't know how this is going to work at all. Okay. How's that?
Yep.
A is for asymmetry. So if you have a mole and you draw a line either horizontally or vertically, it should look symmetric on either side, top and bottom, side and side. B, B is for border. So you want a nice smooth border, nice and even, not like all jagged and scallopy. Like that's bad. And then C is for color. So if it's changing colors, if there's more than one color in the middle, that's not good. D is for diameter. So typically anything bigger than a pencil eraser, which is 6 millimeters, is concerning. And then E is for evolution, meaning any changes at all. So if it's bleeding, getting bigger, itchy, anything, that's not good. So you should get it checked out. So those are the ABCDEs of melanoma. Does that help?
Does it help? I believe it does. So I was going to ask you what are the early signs and symptoms of skin cancer, but I believe you kind of just explained it all in step by step, and should be on the lookout for, which you did. How often should someone get a skin check by dermatologists?
We just got a comment from one of our reviews that the echo is worse now, but I guess we'll just forge on.
Got worse. Hmm.
Um, So how often? Well, that's up to so at least if you've had a history of skin cancer, that's going to depend on what kind of skin cancer you have. So it could be every 6 months or once a year.
Okay. So what should a person do if they notice a suspicious mole or lesion?
So they can either go see a dermatologist. Sometimes it's like a 6 month wait. So, or they can go see their primary care doctor, such as myself. And what I can do is I have an instrument called dermoscope. It's a handheld microscope that magnifies up to 10 times. And there's certain things that I've been trained to look for when I'm looking under the magnifier to see if anything looks more suspicious like cancer or not. And if I think that it's cancerous or precancerous, I can do a simple biopsy in the office. It takes less than 5 minutes. And I can send it to the lab. And if it comes back fine, then we don't have to worry about it. If it's concerning, then that's when I can get on the phone with the dermatologist and say, I took this biopsy, it did not come back good. And this person needs further follow up.
Hmm.
Can I
Excuse
share
me.
the picture that son, the truck driver?
Sure.
So you had asked before about what people should do about taking care of their skin. So I was just going to backtrack to the sunscreen. So I'm going to share this photo here. This poor guy, he is on the cover of Time magazine. Can everybody see that? So you can see he's a truck driver. So this left side of his face got all the sun exposure. So the UVB rays still went through the window, and then this side didn't get any sun exposure. It got less, and you can see how the sun damage just really makes you age because it compromises the texture of your skin.
I'll
So
turn it to that camera now so they can see it. Okay.
So it's pretty telling. So, just a reminder for people who, if you work from home, because a lot of people are working from home and you're sitting next to a window, you still need to apply your sunscreen. Or when you're, even though you might be working in an office all day, if you're commuting, it's still super important because, everyday exposure adds up and it can cause damage to your skin. Not only make you look older, but also increase your risk for skin cancer.
So how successful are the treatments for skin cancer right now,
I would say
if caught early?
if caught early, it's good. If it's like localized, you can just do a wider excision, cut it out, you're good to go. If it's spread throughout, like gone to your liver or your brain or your eyes, that's much rougher. So it is important to get checked. If you find even the smallest thing, any change, get that checked sooner rather than later.
Okay. Are there any advances or research in the skin cancer treatment that are promising right now? Are they coming up with any new development or anything? Because it seems like it's been around for a long time. There's nothing.
I would say from the primary care perspective, one thing that's been pretty cool is when people used to get a lot of actinic keratoses or seborrheic which are like precancer. So they're kind of like, I describe them like little barnacles. So they're like little rough patches. Like you see people, they have like little white scaly, it feels rough when you run your hand. So those are like precancers. And back in the day, we'd have to like freeze every single one. But now there's this cream that you can just put on, like it's called 5FU or 5-fluorouracil, and you can just rub it on everywhere. So it's like a lot easier. But it is pretty aggravating to the skin. And it's like your skin turns red and then like kind of like sloughs off, but it like sloughs all of the precancerous cells off. I mean, I think
Really?
that's pretty cool instead of having to freeze every single little lesion.
Hmm. So one of my things is that I wrote down here. What are some common misconception about skin cancer that you come across of?
I think common misconceptions are, like I said before, that it's only on sun exposed areas. That maybe only like light skinned people who burn easily are going to get skin cancer. I think we all have to be vigilant about it.
All right, quick comment. I like it. I like it. So one of my things that I always try to touch in is every podcast. I always talk about community, public, and stuff like that. So one of my questions: how can schools, workplaces, and public health organizations better promote skin cancer prevention? So I find that simply just one person talking about it doesn't reach out everyone. So how do we educate our viewers, our kids, our basically friends, and everyone as a whole, and try to get the word out?
Well, I'm not sure about how to get the word out, but I can tell you that what I would advise my patients is to make wearing sunscreen a part of your daily routine. So, like when you wash your face or brush your teeth, you should already have on your bathroom counter a face sunscreen that you can just apply, and it just becomes second nature, just like brushing your teeth. A lot of people say, "Oh, yeah, no, I don't think about that. I wash my face, and
So I
that's
should
it."
put sunscreen on before I go to bed?
No, not
Oh,
before you go to
alright,
bed, before
alright.
you're gonna leave the house for the day.
Alright.
But I guess, I'm thinking about what you would say about the community. It would be fantastic if children in school before they went out for recess, like on a sunny day, if they could apply sunscreen
So
because
in
they're
other words, parents should pack it in their lunch bag instead of bologna and cheese sandwiches.
well, ideally they're getting it before they leave the house to go to school, but again, like maybe reapplying because they're running around and like sweating and then the sunscreen's coming off. But that would be a fantastic
So maybe
idea.
a bottle of water and a little tube of skin SPF.
Yeah.
Okay. Okay, what message would you like our listeners to remember more about skin cancer this month?
Skin cancer is more than just skin deep. So it's important. It can kill you.
All right, all right. So, Dr. Wang, thank you so much for speaking on behalf of skin cancer. And once again, I really appreciate you being on from all your years in primary care physician and owning your own practice, caring for all. And also, I appreciated that you did a HRT session over, and obviously from that review and everyone's, you're getting a lot of calls on that, and I'm so happy for you. But I also know that you kind of wanted to end with possibly a little open skit that you had tried to put together for a little comedy hour with or count comedy second with Dr. Wynne Huang. So everyone, please stand by. Dr. Wang has a few little what should we say?
I'm transitioning into comedy mode.
Yes, she's going into comedy mode so you can see the other side of Dr. Wong. Please, Dr. Wong, the stage is yours. That's people screaming for you.
Uh,
Go.
okay. So I'm going to start off with a classic. Oh, what is that message there?
I have no idea. It's probably low mode.
Okay.
Yes, but I'll fix my low mode.
Um, so I'm going to start off with a classic joke to get some people engaged before I go into some commentary. So, and I can get away with this because, as you can see, I'm Asian. So, Mr. and Mrs. Wong just had a baby, and the nurse brings in the baby and says, "Congratulations, Mr. and Mrs. Wong. What are you going to name the baby?" And Mrs. Wong and Mr. Wong look at each other because it's a white baby, and then go, "Well, two Wongs don't make a white, so I think we should name him something Wong."
Something wrong.
No, something
Something
Wong, something Wong.
something wrong.
Yep,
Okay. Okay.
yep.
Okay.
So,
Good. That's a good one, Dr. Wong. It's a
uh,
good one. Oh, hold on. Go ahead.
And then this isn't really like a joke, but I just want to share my frustration sometimes. Like I have all these things that happen to me at work. And for some reason this week, a lot of don't take this personally, a lot of men were getting to me and with their ability to listen and take direction. So I just want to share some of my aggravations with giving men direction.
Okay.
It wasn't necessarily this week, but I wanted to share. So tell me if you think this is like normal male behavior.
Absolutely.
So
Being a male, I think I can tell you.
I have like three kind of exam rooms, and I'm like running around like trying to like multitask and whatever. So I try to run a tight ship and stay on time. So one man comes in burning when he pees. I have another patient in a room. So I say to the man who's burning when he pees, I go, listen, I need a urine sample. So, here's a urine cup, need a urine sample. While you're doing that, I'm gonna check on my other patient. I'll be back. All right, sounds pretty basic instructions. So I go see my other patient. Let me go check on my guy who's peeing. Is he ready? I go into their room just to see if he's back in the room. Do you know what I found? I opened the door. I go, whoa, he was peeing in the room into the urine cup. I mean, do I really have to tell him that he has to go to the bathroom with the urine cup? I mean,
Well,
what is it like with
oh,
men and directions? Am I supposed to say, here's a urine cup, bring it to the bathroom and
do you
pee
want
over
me
the
to
toilet?
validate that?
Yes.
Is he a new patient?
No.
Has he ever peed in a cup for you before?
No.
So, if to be truthful, if I was to walk into a room and you were like, I'm leaving you alone, pee in the cup, as you stated, I'll be right back. I would basically think you were just telling me I needed to pee right
Do you
there.
think a woman would do that? A woman wouldn't do that.
I think it's a little different from a guy than a female. I think we're built a little different.
Okay, so
So if you told me the restroom is right there in the corner, please proceed over there and take a pee instead of just here's the cup, pee in the cup, I'll be right back. To me, that would mean like, okay, this is a weird place. They want me to pee in the cup.
okay, I don't know. I'd
Okay,
appreciate
so wait a
I'd
minute.
appreciate
Wait a
some
minute.
commentary from the
You're
viewers.
you're doing something against a guy, and I'm gonna do something about a girl.
All
How
right.
come when I go see female doctors or female chiropractors, they always want me to take my underwear off?
Actually,
So explain that to me.
actually,
And you've actually been there. So why does everybody want me naked?
actually, you know what?
You didn't not answering
No,
me
no,
though.
because I'm gonna tell you a funny story.
Okay.
I don't want you naked. I mean, like, okay, well, you're my husband, that's different. But I don't want you naked because that was actually gonna be my other story. So this one time, when I was filling in at an urgent care and the nurse brought this guy in, I go, "What's this guy here?" She goes, "Numbness and tingling in his hands." I'm like, "All right, fine." And so she goes, "I already roomed him for you." I go, "What does that mean you roomed him?" So because I was new to the practice, and she goes, "I put him in a room, I did his vitals, and I said, you'll be right in." I walk in the room, the guy is completely naked except for his underwear. And
That's not completely naked.
I said, except for his underwear. And I said to him, I said, did someone tell you to get undressed? Did the nurse tell you to get undressed? And he was like, no. I go, so you just decided on your own to get undressed, and you don't have to get undressed because I'm just looking at your hands so you can put your clothes back on. So again, a man who just decided to make his own directions.
Yeah, but how come you didn't answer my question? How many times have I been somewhere where they're like, I leave my underwear on, they're like, oh, take it off.
Well, I can understand where those people are coming from.
Uh, even some guy doctors.
Yes. I
Why does he need to take off his shirt just to test his blood?
I don't know. I
Some
can't answer
weird
that.
crap.
But I don't want you doing that.
Trust me, I don't either. So what's your other joke? Where we going?
I told you they're not jokes. They're just
Oh, you got more stories.
I'm
Oh,
just
please, the
sharing stories.
floor is yours, Doctor
I'm
One.
just sharing stories. And for those viewers out there, if you're enjoying this, I would like some feedback to see if I should continue with these stories. But I guess for now I'll stop.
No. You can't just end it with just a story and an argument. There has to be some comedial ending, something. There has to be a punchline. There's got to be something that's driven.
Um,
What's Tell one of your famous jokes.
no, I'll share.
Tell them your mushroom one.
No, how about I'll share a story about I know we'll tie it all in skin cancer and
I
um
thought you told me skin cancer is not a joke.
it isn't. But I remember one time my dad came out. You know how I feel about my dad. But anyway,
He's a great guy.
he's a great guy. He had something on his butt crack that he was worried about. And again, we should take this seriously.
Mm.
So I tried to pawn him off on one of my estheticians. And I said, go see Cindy. She's great at skin. And I didn't tell. I said, listen, you got to check out my dad, and he has this funny looking mole, and I want you to check it out. And she came back and yelled at me because she said she only deals with the neck up. She wouldn't look at my dad's butt.
So you try to sell off your dad's ass to someone else. So
I
you
sure
try to
did.
prostitute your dad's ass out.
Yep.
That's just wrong.
And it sure didn't work out well because another man who couldn't follow directions, and strangely enough, he is or was a doctor. And so I said, Dad, listen, let's keep this professional. I'm going to give you a little drape. You cover up. I only need to see this one spot, this one spot. And I said, I'm going to step out. You do whatever you got to do, and I'll be back. And I think I have PTSD. I opened the door, and my dad, it's clearly didn't understand, didn't use the sheet. Everything's exposed. And I'm like, I shouldn't have to see any of this because his drawers were down, things were hanging that I shouldn't have to see.
So you felt good that day.
He was kneeling on the bed, like
a dog.
Yep.
Rough.
Yep.
Dad's there.
I can't get that image out of my head.
He gave you the brown eye and a lump on his butt. As long as it came back negative, though, right?
Well, yes, this is true.
Seeing that, and so it was worth it. You saved, by looking at your dad's brown eye, you saved his life.
I sure did. But then, so Asians by nature are very, very competitive. Very competitive.
So he wanted to compete against his butt.
No, so then my mom wanted to compete. So she goes, I heard you looked at your dad's ass. She goes, I want you to look at my vagina.
Nice.
And so
good day for you.
So I
got to see what made you,
what made me,
and what birthed you.
Yeah, but no person should ever have to see this. And you know what?
You should be honored that they trusted you as a doctor and knew your experience. Okay, that they trusted
go
you.
see your own doctor. Don't be a cheap Asian. Pay the co-payment and go see. And then I know they paid thousands of dollars to meet me. Yeah, go see my brother. He's a radiologist.
Why pay the cost?
So anyway, I think I should get some credit for being as normal as I am. I mean, thinking about what I've been exposed to.
Step back down on that one, but go ahead.
So what I've been exposed to, I am a pretty normal person. Like nobody should have to go through that.
Okay. All right.
And if these are true stories, and I can't make this up. So if you enjoy hearing these stories, I can share more. I have a lot more.
No. All right. Well, once again, thank you so much for joining Security Tales. And I really feel blessed to have Dr. Huang with us today.
I'm your wife.
And also my wife.
We're the same person.
Yes. And I appreciate the time. And happy Memorial to each and every one of you. God bless. Be safe. Keep an eye on each other. And be careful. All right. Mad love, mad respect. God bless everyone. Dr. Huang, would you like to say goodbye?
Goodbye, everybody.
That's it? Just goodbye, everybody?
Till next time. Give me some feedback.
Give us some feedback. Thank you so much.
I'm going to quit being a doctor if I get enough positive feedback.
Oh, God, no. All right, everybody on Security Tales YouTube. Thank you so much. Have a blessed day.
Honey, you can't hit me with